It seems like we're addicted to something or the other. Love shopping? Then you're a shopaholic. Love chocolates? Chocoholic. Constantly working? Well, workaholic. We tend to throw the word addiction around and use it so many times as a synonym for liking something excessively. But are we, in doing so, belittling the rampant disease of addiction that plagues all corners of the world? Hello, and welcome to this week's episode of Global Healthcare Archives. This week, we're going to look into addictions and unwrapping what it means from a medical perspective. And there's always a little something for everyone to learn. So let's dive right in. So what is addiction? Broadly speaking, it is a long-term inability to moderate or stop the intake of something despite its possible harmful effects. This includes the consumption of harmful substances or even activities such as gambling or pornography. For the purpose of this episode, we'll be limiting our conversation to substance addiction only. Substance addiction is one of the oldest diseases that humans have been dealing with. Yes, we're calling it a disease, not a habit or a weakness. In fact, in a report in November 2016, the US Surgeon General nominee Dr. Vivek Murthy publicly confirmed what researchers have known for years. Addiction is a chronic disease accompanied by significant changes in the brain. Developed nations like the US are fighting addiction predominantly to opioids and other drugs. Emerging nations, on the other hand, like India, are trying to win the war against alcohol and tobacco abuse. Let's explore this a little more. In India, it's socially acceptable to smoke or to chew tobacco. While Dadajis smoke bidi as part of their evening recreation, women often brush their teeth with misri, a mixture of tobacco and teeth whitening powder, and with equal zest as part of their morning routines. Additionally, the culture of acceptability of alcohol consumption and of casual smoking makes alcoholism and nicotine addiction rampant across all socio-economic strata, and this is especially true for emerging nations. In the US, the story differs with the opioid epidemic. In the late 1990s, opioid-based pain relievers arrived in the medical scene. These were more potent than the available analgesics and offered the promise of a pain-free recovery from major operations. Pharma companies assured the medical community that patients would not become addicted to prescription opioids, and so healthcare providers began prescribing them at a very high frequency. This subsequently led to widespread diversion and misuse of these medications, far before it became clear that these could indeed be highly addictive. By then, however, the damage was already done. Today, over 100 people die each day in the US itself due to opioid misuse. Although reparative measures have been initiated, a burning question continues to remain. Are we glamorizing addiction? Think about this for a second. Be it a hit number like Bidi Jalale, synonymizing smoking with entertainment, or multiple instances of a film protagonist jilted in love, drowning his sorrows in alcohol, or even a star character artistically lighting up a smoke, the super peers of Bollywood justify the consumption of these substances. Well, Hollywood is not too far behind. In fact, it could be argued that it did set the tone for this. From Bond with his martinis to the portrayal of Dr. House and Dr. Sherlock Holmes as high-functioning individuals addicted to drugs, the consumption of recreational drugs and alcohol is portrayed as not only acceptable, but also something to aspire for. So then, why are we calling addiction a disease? Most stimulants, including nicotine, cocaine, and amphetamines, exert their action by elevating the synaptic levels of dopamine, norepinephrine, and serotonin, and by blocking their uptake. Thus, physical dependence and withdrawal symptoms, which form the habit part of addiction, are due to changes in the neurotransmitter reactivity. Thus, the potential for relapse in addiction appears to persist indefinitely. Governments the world over are handling this problem in very different ways. The US Department of Health and Human Services is handling this problem with 5 priority points. Improving access to treatment and recovery of services, promoting the use of overdose-reversing drugs such as naloxone, facilitating better public health surveillance, providing support for cutting-edge research on pain and addiction, and advancing better practices for pain management. Federal regulators have introduced new limits for opioid prescriptions, advising physicians not to prescribe opioids as a first-line therapy, thereby reducing the total nationwide prescription in 2017 by 25% from its peak in 2012. The DEA reduced quotas for pharmaceutical manufacturers by at least 25% for opioids categorized as Schedule II drugs. For those that are currently accepted for medical purposes but carry a high risk of misuse, such as oxycodone, phenytoin, and morphine. India, on the other hand, has addressed the issue by issuing a ban on advertising tobacco and alcohol, and increasing the taxes on both types of goods. However, these measures seem to have had limited success if the record-breaking sales of tobacco and liquor, despite the lockdown, are anything to go by. Additionally, the ban on advertising can hardly be termed as efficient and successful unless you truly believe that the popular liquor brands are primarily manufacturing cassettes, CDs, club glasses, and of course mineral water. On the other hand, instances of successful strategies would include the recent inclusion of information on substance abuse as an obligatory component of the school curriculum and public awareness campaigns. Of course, this features superstars and sometimes even actual patients with cancer. This is further supported in mainstream media by the mandatory disclaimers in movies during a scene which has liquor or tobacco consumption shown. Additionally, the Ministry of Health and Family Welfare has established several de-addiction centers, with over 130 such centers spread across the country currently. The Narcotics, Drug and Psychotropic Substances Act of 1985 bans the production, possession, sale, purchasing, transport, storage, or consumption of any psychotropic substance in India. Unfortunately, this act is not without ambiguity. For example, the use of marijuana is prohibited in India. However, the consumption of bhang, an ingredient in cool drinks and sweets during the festivals of Holi and Shivratri, is permitted, on cultural grounds, of course. This would be equivalent to banning whiskey while permitting the consumption of country-made liquor, colloquially called desi daru. The US too seems to be working in opposing directions, regarding weed, for example, and its products, with 2/3 of the states permitting its medicinal use while the remaining 1/3 ban it. Comparatively, the Netherlands seems to have a more forward approach and an effective way to handle this problem. The Dutch have accepted that it's impossible to completely remove the use of drugs. This has led to the famous Dutch coffee shops, where the sale and consumption of soft drugs like marijuana is allowed in small quantities. The coffee shop concept has several advantages. Cannabis is often referred to as a gateway drug to harder drugs such as heroine, LSD, etc. By decriminalizing the use of soft drugs, the coffee shop succeeded in enabling cannabis consumers to avoid exposure to hard drug areas and to markets where they're traded, greatly reducing the dangers of an open drug scene and exposure to uncontrolled criminal elements. This also contributed to a preference for drug consumption not involving injection. The Netherlands was spared the major drug-linked HIV epidemic that devastated other European countries. Furthermore, Dutch cannabis consumers have been spared the profound cost of carrying a criminal record because, let's be frank, weed cannot be considered at the same level as heroin. Additionally, the public has not had to bear the cost of imprisonment for offences that are considered minor in most regions. While governments the world over are encouraging rehabilitation centers, the social stigma attached to being admitted in a rehab forces patients to either seek admission in secret or to avoid it altogether. It's time we looked at addiction not as a habit, but as a disease. We wouldn't look down upon patients with other disease such as cardiac disease or cancer, would we? We do celebrate people who overcome these diseases as survivors. So why not celebrate patients of addiction who are brave enough to admit their problem and to seek help for the same? Why not celebrate them as survivors too? Well, that's it for this week's of Global Healthcare Archives, and we look forward to seeing you next week.